Recording. Welcome to the May 20th Sacramento County Public Health Media Briefing. As a reminder, please stay on mute until our question and answer time. And I will go ahead and hand it over to Dr. Olivia Exterior.
Good morning, everyone. Thank you again for joining us. So I'll start off with a brief update on where we're at with the numbers. From the update this morning, we're at 105,540 cases of COVID-19 reported to Sacramento County and 1,695 deaths. According to our update and our dashboard, for the first time this week is when we have started seeing our case rate drop below 6. So for this morning, it's at 5.8 per 100,000. But of course, we do have to depend on the state blueprint update for being able to move tiers. And for this week, it was at 6.3 per 100,000. But our expectation is that next week we will be able to meet the criteria for the orange tier for the first time. We do have to have two weeks in sequence that are below the 6 per 100,000. So we are still hoping that we'll be able to make it before the June 15th deadline. So I will now move it to Rachel to give an update on our immunization efforts.
Morning. I have the numbers for our vaccine allocation for next week. We will receive 25,070 doses of COVID vaccine that's available for Sacramento County providers. That's 24,570 doses of Pfizer and 500 doses of Moderna. And again, no allocation of Johnson & Johnson vaccine this week. And then I wanted to add a couple of other things. We have an update on our website where businesses and places of worship can request a pop-up clinic. And so they can go on the website and put in that application, and then we'll pair them with a COVID vaccine provider, whether it's a pharmacy or one of our teams or another provider to come out and provide COVID vaccines on site for them. So very exciting to start doing that. And then we are also going to, we have some plans in development with some business partners in the community looking to start holding some fun events, wanting to increase vaccination rates and, really get out and start doing some things that will draw the population in that we're still needing to target. So stay tuned. We'll have more details on that as well in the future. And I'm going to pass it over to Megan Sheffield.
Thank you. Hi, everyone. As we mentioned last week, we've deployed 2 mobile operational support units that are being used for mobile vaccine clinics in Sacramento County. We had a very successful clinic yesterday at Valley High Library. And today we are out at the Department of Human Assistance offices on Fulton Avenue. We'll be here from 10 to 2 today, and we'll be at the DHA offices on Research Avenue tomorrow from 10 to 2 as well. Our focus, as Rachel was just saying, is to continue to host smaller community-based vaccine clinics and to provide a convenient and safe place for residents to receive their COVID-19 vaccine. We're working with several community-based organizations, faith-based organizations, and shopping centers to schedule upcoming pop-up clinics. And the dates and locations for where those clinics are located will be posted on the county website, Facebook, and Twitter. And in addition, residents can call 211 to find local clinics and get assistance scheduling appointments in a variety of languages. All the appointments are available through My Turn, but clinics will also accept walk-ups. Vaccines are free and patients do not need to have an ID to receive a vaccine.
Thank you, Megan. Okay, that concludes our staff update today. So we'll go ahead and open it up to questions. You can either utilize the raise your hand feature or the chat. And I will just call in first come, first serve. Okay, Alex, go ahead.
Hi, Alex from the Sacramento Bee. So you guys are obviously, it sounds like, pivoting a lot more towards these pop-up events and clinics. I'm wondering, have you seen that in general, these sort of appointment style events are more useful or like more well attended than sort of a consistently scheduled clinic? Yeah.
So I can start. The purpose of the pop-up clinics is to be able to bring the vaccine into the communities, especially for the underserved communities where they might have barriers to being able to attend our regularly scheduled higher throughput sites. And so they're very different in the way that we organize it in terms of being able to take walk-ups, and they tend to be smaller. They are necessary at this time, especially as we are seeing a reduction in the demand for vaccines. So it's just a different phase that we're at, where we're doing more of these to bring it more into the communities.
Okay, Chris, go ahead.
Two related questions. How frequently, I know you mentioned that churches or businesses and places of worship can apply online to be pop-ups. How frequently is the county seeking out businesses and places of worships to be pop-up instead of the reverse? Just because I know the county knows best in terms of which zip codes and census areas are struggling the most when it comes to vaccines. How frequently is the county doing that instead of the reverse? And then the second question is, what are the requirements for a business or a place of worship to be able to be a pop-up site?
Mike, do you want to take that?
Sure. Yes. To answer your first question, with the faith-based organization, community-based organization, really frequently we're in constant conversations with a lot of the faith-based organizations, and doing that targeted reach, tapping into our networks to really see mosques, churches, temples, whichever faith-based organizations are interested, as well as community-based organization. And it kind of segues into the second part. And because of that, there's a lot of logistics and requirements, but I think there's additional resources, potential resources where we can, some of the requirements may look less, some may look more, depending on which pairing of that resource we decide moving forward with the organizations to host these clinics.
Thanks, Mike. Chelsea.
In terms of the fun events, is that something kind of like how other places have had shots for shots, things like that? And then the other question I had was, why would it matter for us to move to the next tier, knowing that the tier system is going to be gone in a couple of weeks?
So as far as the events, we are exploring all the different ideas and looking at what other counties have done. So we have not narrowed down which ones we will start with, but definitely looking for ideas for that. And as far as the importance of moving to the next year, yes, it's still important, because moving to the next year means that the number of cases that are occurring on a daily basis in our county is reducing. And so that is still important in getting us to the goal, because we want to get as low as possible by the time we get to June 15th. We know that the tiers will go away, but then even if it's just for 1 or 2 weeks, I think for businesses, it's also important because they will be able to increase their capacity. So for those two reasons, one, it still shows that we are heading in the right direction in terms of reducing infections in the community. And also it will be a great advantage to businesses in terms of being able to increase their capacity.
Hey, Michael.
Hi, this is Mike Sacchi. I noticed on the county's dashboard there continue to be some increases in the number of confirmed variant cases of a few different variants, including the B117 from the UK. So I'm just wondering if we could have any additional context of whether those are actually becoming more prevalent, or is it just a greater amount of sequencing and lab testing for those?
It's probably a combination of both of the things that you mentioned. One, there's definitely an element of surveillance artifact, considering that they batch these, and they're not done for diagnostic purposes. They're done, on a large batch at a time and sent back to the county. So that's definitely part of it. However, we are also seeing, I think it is also indicative of an increase in circulation of both the UK and the West Coast variants locally. And then if I could just comment one more around a prior question regarding business requirements. And I think we would encourage any businesses to apply, even if they think they might not be eligible or meet all of the requirements. And we will work with them to make it work for them. So a lot of times it has to do with the size or how many people they're anticipating. But our team will work with businesses to make sure that it's a safe environment and figure out how to get their employees or their groups vaccinated. So we just encourage people to apply, and we will do everything possible to get them the vaccine.
Okay. Chris, you have a follow-up question?
Yeah, thank you. Knowing that obviously the June 15th date is coming up, and knowing the numbers in the county right now, specifically as Mike mentioned, with the increase of the variants in the county, what is the county preparing to do to, I guess, put out the word that despite this June 15th thing happening, we are still struggling to make it to where we don't see increases after that date?
I think at this point, our main message is the vaccination, because that is our way of being able to get past this pandemic and get people back to their normal, regular lives. So all the efforts that we're putting in terms of the high throughput sites, but also in being able to do outreach to communities, to make it, to reduce barriers so that people are able to get vaccinated, to address questions that they have, especially for those that have some hesitation, making sure that we're able to provide answers to their questions and, getting the vaccine out as much as possible.
A follow-up question from Alex.
Hi, yeah. So, I maybe I'll ask for some follow-up data later on, but across the board, we are struggling to vaccinate people, and I know a lot of focus has been on specific zip codes, but basically every income level, every demographic level, we are behind vaccination rates, behind like the statewide average. And so I'm wondering, has the county done any sort of assessment on why this is happening? Because I think the question I keep having, and lots of people keep having, is it a hesitancy thing? Is it so many people have gotten COVID, they feel like they don't need the vaccine? Is it like people are working jobs that are not flexible, so they can't go to these pop-up sites? I just really, it's, I'm sure for everybody, very frustrating to see the number of people vaccinated in county really, really slow down and not have a sense of why. And so I'm wondering, do you guys have a sense of why across the board Sacramento is struggling?
I'll start it off and then I'll turn it over to Jamie to add on to that as well. I think if you look at the information by zip code, you'll see that there is variation, where we actually do have some zip codes that have up to 79% vaccination. But we also have some areas, as you've mentioned, that are struggling, where it's less than 20% vaccination. And that is part of the reason why it's important for us to be able to focus our resources in those zip codes. And what we've found, especially overlaying that with the information we have from the state for using the Healthy Places Index, is that the areas that tend to have low vaccination tend to be in the underserved communities. So being able to work with community-based agencies to find out the reasons why, and as you've mentioned, asking those questions. And what we've found is that it varies. For many of them, it's a matter of being able to hear it from a trusted messenger. And that's why we are reaching out to religious organizations and churches, because we found in many cases that these are places where the people in those neighborhoods trust those areas, those services, trust the people there, and would be willing to get vaccinated if the vaccine is at those sites. And also looking at other barriers, we know that for some it's transportation. For some, they just will not leave their neighborhood for one reason or another. And so being able to get to those neighborhoods again, to reach out to them. We have, of course, also heard some of the questions that come up that are based on conspiracy theories that are floating around on social media. So hearing what those are and addressing those questions is important as well. And I'll turn it over to Jamie if you have additional questions.
Yeah, I think Dr. K, you covered most of it. You know, I would echo that we are seeing disparities still. There are differences in who's been vaccinated and who's not been, and that's a lot around economic ability and access issues. I think if there was a single answer, then we would have an easy solution. So like Dr. Kasiri said, it's multifactorial, and it can be access issues, it can be hesitancy issues, it can be that people perceive there's no more incentive to, since we're opening up in January 15th anyway. And as you guys recall, you know, there was 1 week where Sacramento County got a single tray of Pfizer early on. And if 2020 taught us anything, and toilet paper in 2020 taught us anything, it's that people want things when they're a rare resource. And so there was kind of this early rush to get vaccine, and our county was behind from the get-go because we did not get the inventory. And we were able to get everything out into people's arms as soon as we got them early on in the pandemic, early on in the vaccine rollout. And I would say our strategy is also has to be multifactorial. There's not a single solution. So like we said, we're doing these community pop-ups. We've got trailers. We're engaging in other mobile options for providers. We're shifting McClellan to weekends, community sites, evening hours. So there's lots of different approaches. We're also actually calling individuals who have missed second doses. So there's a whole lot of different strategies that are being employed to try to address the issue.
Yes, and we're also collaborating with schools and having a lot of our clinics in schools in collaboration with our health system partners as well.
A question from Michael.
Yeah, I just had a follow-up on allocations and supply amounts. Rachel mentioned, I don't remember if it was the second or third consecutive week that there's no Johnson & Johnson allocation from the state, and so I'm wondering, one, if that's is that a local decision or a state level decision, and two, is there any challenge anticipated with that as far as trying to get businesses to sign up to do these pop-up clinics, knowing that you know what we mostly have are 2-dose vaccines, and they would potentially need to do 2 clinics. Yeah, those are my main questions.
Okay, yeah, I can answer that. So there's plenty of Johnson & Johnson vaccine in Sacramento County. So with Blue Shield taking over as the administrator of the program, they're looking really at the state as a whole and trying to shift resources where it's needed. And because we have plenty of Johnson & Johnson, we had taken a pretty large allocation right before the pause. And many of our providers had it in their fridge ready to go for large throughput sites, and then we had to stop using it, and then the uptake has been slower since then. So we really have plenty of doses, and we are taking it to every pop-up that we do. We take either Pfizer or Moderna, and we always take Johnson & Johnson as well. And any provider that has requested Johnson & Johnson is is able to get the vaccine either from us or we're redistributing from other partners. So I think we have enough supply, and I think if we were to utilize all of that and need more, we could reach out, and I think that we would get that. So it really is a decision looking at the whole of what each county truly needs at that moment in time.
Okay, Chris.
I guess my question is, I guess I'll put it a little straightforward. Is the county's messaging on vaccine working? I mean, as Alex mentioned, we are behind in a lot of statistics when compared to the average for the state. I mean, is the messaging working? Do you guys need to pivot with the messaging as you guys have with doing smaller clinics?
Yes, we believe it is working because in talking to the people that come to these clinics, for example, with the trailer, we had a steady flow of people, and we heard from some of them, and some of them very appreciative that it was in their neighborhood. Some of them telling us that they heard about it because someone came and knocked on their door and told them about the clinic. As we've mentioned, we are trying a lot of different ways because we know that it's multifactorial. People get information in different ways. For some, it's through word of mouth. Some it's through social media. And for others, it's, having the community-based agencies, our partners, going door to door. So yeah, we are doing everything that we can, and every shot counts. We do recognize that because we are doing more of the outreach and going out more into the community, it does take more for each vaccine shot that we're able to give. But we know that that's what it's going to take, especially when we're going into some of the underserved neighborhoods and building that trust and being able to get the vaccine and reducing barriers as well. So yes, it is effective. We plan to do more, and of course, as we work with our partners, looking at different ways of doing it, because right now we might find that maybe doing something where we're offering free ice cream might work. So we're willing to try it and see what will happen.
And I have a final follow-up question from Alex.
Hi, yeah, I apologize if I missed it at the top. I know, Dr. Kasiria, you were saying that we have reached under that 6 cases per 100,000. I was wondering, do you know what the, I think they called it like the equity, like cases in equity areas. Do we know what the case rates are like there? Are they still higher than the overall county case rate?
I do not have that with me. I do know that the case rate does tend to be a little higher for the underserved communities. And Jamie, I don't know if you have anything more to add to it. If you're referring to the blueprint for the health equity indicator, they're actually looking at positivity rate. And for the positivity rates, we have met the criteria for the orange tier already. It's the case rate that is kind of lagging behind. Jamie, I don't know if you have anything you'd like to add.
I would just add that we have a map, a location tab on our dashboard. And it's interactive. So if you click on the individual zip code, it'll come up with a data table that gives you all of that detailed information behind it.
Okay, I do not have any more questions in the queue. So just a reminder that I will send out this full recording, hopefully within the hour. And I'll have some additional data in that email that we talked about today. And we will see you guys next week for our next Sacramento County Public Health briefing. Thanks for joining.